Tammy Kavwich, and this is Scott Malloy. Scott's the director of the Gallatin Mental Health Center and the Mental Health Center in Park County, which is all part of Western Montana Mental Health. And Scott and I served on a board in central Montana in Helena for the Central Service Area Authority, and it was a great experience. And I want to ask Scott some questions. The first question I want to ask about is crisis intervention. I want you to tell people what they can expect, because it's scary for people if they don't even know what to expect, if all of a sudden they're needing crisis intervention.
Yeah, I think one of the things I always say is crisis intervention, like many other kind of social issues, is tough because you don't need to know about it until you need to know about it. And so one of the commitments we have with our organization is to make sure we do everything we can to educate people about crisis intervention. So if you or a loved one, a coworker, a friend experiences a mental health crisis, that you have some simple steps that you can take to make sure that you kind of go through the right process. Because there's a wrong way to go through a mental health crisis, and there's a right way to go through a mental health crisis.
Tell us all about it.
Yeah. So I also have to point out that we always talk about the mental health crisis system because it's real and there's a lot of devastating effects to it, but there's all sorts of other stuff that hopefully is talked about and that the communities are doing and we're trying to do that would prevent someone from going into a mental health crisis. So we always like to point that out because the crisis system is very robust and there's been a lot of movement in this community, and I also want to say that there's a lot more that we should be doing on the other side of the continuum.
I absolutely agree with you.
So we were fortunate in this community in Bozeman and Livingston and really the region of Park County, Gallatin County, and part of Madison County that 4 to 5 years ago we were at a place in the community where there was really no crisis system. And so we were pretty blessed in the sense that we were able to really start from scratch because of years of inadequate care for people that were experiencing a crisis. So through a lot of meetings, stakeholders, advocates, providers, we've been able to create a fairly comprehensive system. We're by no means perfect. We have a lot of work to do.
Tell us who all are the stakeholders.
Yeah, so the hospitals in each region, Livingston Memorial, Bozeman Deaconess, law enforcement in each region. And law enforcement encompasses not just the sheriff's office, but the police departments, and we also have multiple police departments in Gallatin, and we have the MSU police. And you have, sometimes you have the Forest Service and the Montana Highway Patrol. So there's a lot of law enforcement agencies. And you have the whole healthcare community that is at play here too, not just the mental health community. You have advocates, you have family members, individuals themselves with mental health. Those are kind of the folks that we would want to be a part of the system change. And so some of the key elements that we have for a crisis system is, first and foremost, if you remember nothing about what I say, is if you are in crisis, call 211. So 211 is the information and referral line. And so there is a crisis line that's associated with that. There's an 800 suicide line. There's a local number, 586-3333. But the easier number to remember is 211 because that gets you to the local crisis line. The point of our crisis system, and I think that is part of most successful crisis systems in the country, is you have to access care at the right place at the right time. Right. And really, for most people that are experiencing a crisis, the law enforcement and emergency rooms are not really the place you want to get help. But there is other alternatives that are more effective to the individual or the family going through that crisis.
What is the best place for
Yeah, and I think I'll lead into that with the key elements of our crisis system is we have a crisis intervention training that we've been doing now for over 6 years that is for law enforcement and first responders. And we're having an academy in Livingston in 2 weeks, and that's the first academy we've had in Park County ever.
Wow.
So we're very excited about that. And we've done now 5 or 6 in Gallatin, and we do a lot of statewide coordination and assistance with that too. So
what do you find is the responses from law enforcement when they've had that training? How are they receiving that training?
Well, it's wonderful. I think it's job and life changing, and we do that in conjunction with the Gallatin Sheriff's Office. So we have a mental health professional and a sheriff's deputy that does that, and then there's a whole host of other people that help put on the training, but it's really a law enforcement mental health training that's done in conjunction, and I think the law enforcement respond really well to other law enforcement officers that have gone through it, or that can kind of say, hey, this is good, and this is how it affects your job and makes your job easier and helps you provide better care to those calls that you go out on right now that are really frustrating. So that crisis intervention training is really a key piece of what we've done. The other thing that we've done is obviously really focused on the access. I kind of went back to that. How do you access help when you're in crisis? And starting with that kind of crisis line is important to remember. And then as you go kind of down that continuum or process, what we really want people to do is, if you are unsure of where you should go and you've called the crisis line, or maybe you forget to call the crisis line, all that, or you're a family member, just remember that you can get an evaluation at the Hope House. And so if the crisis line it isn't effective as far as talking through that kind of crisis or whatever, that's where we really want people to access help.
And how do people...
A lot of people drive themselves there, so, and it depends on what is going on, but family members can bring people, friends can bring people, law enforcement brings people. At the end of the day, that's part of that process to determine what's going on with that individual and get them to the place they need to go. The Hope House provides, and Hope House is a crisis stabilization center, and it's for people that are 18 and over. So part of the gap in our crisis system is we don't have a crisis system for kids. So we can
our work is cut out for us.
We can address that. Not that it's not an issue, but we're really talking about, in large part, an adult system. The evaluation piece we do for kids, but there's nowhere to place them, and that's probably a different interview, different discussion for the kids. But that is being worked on. But for an adult, you can get that evaluation and treatment at the Hope House right now, and that's a much better place to get evaluation and treatment than the local emergency room.
And I'm not at all ashamed to admit that I had to stay at the Hope House one time, and I was so grateful. I had just learned about it, and then when I had a crisis, I knew exactly where to go.
The Hope House, again, some people will come there and you meet with a mental health professional or crisis response team, which is part of the crisis system. Is we have people on call 24 hours a day that are meeting and calling with people that we're talking about that are in a psychiatric crisis. So you could meet with somebody and get a plan and go home. Get referrals, get connected back to your team if you have one. If you don't have a team, and I mean team by a lot of things. It could be a healthcare provider, it could be your therapist, it could be your spiritual community, whatever that is, link that back. And some people might need to stay at the Hope House as more safety and support, or just kind of more time to kind of figure out what's going on, and that's available too. So you can get evaluated, get a plan, and go home, or you could stay and kind of get some additional treatment. So there's some different options that occur if you come and get evaluated for that kind of piece of the crisis process.
So let's talk a little bit more about the Hope House, because that was definitely one of the things I wanted to talk to you about. It's a facility here in Bozeman at the Gallatin Mental Health Center, and of course its purpose is crisis intervention. And I would tell you it's beautiful. It's absolutely beautiful. The staff are so friendly. There's nothing scary about it. It's a very loving atmosphere. How many beds do you have? Anything else you want to tell us about Hope House?
Sure. We have 8 beds on the voluntary side. And voluntary, is somebody's willing and wanting to be there. And that's what most of the people are that come to us. On the involuntary side, as it's called, is 2 beds. And those are court ordered. So somebody is unwilling or unable to get help because of their mental illness, and they pose a danger to themselves or others.
Right.
And so those people are ordered there from the court. And that process is very much a legal process where they're there, and there's multiple evaluations to determine if they need to be committed to the state hospital or they can be released for additional treatment. That's really a small portion of what we deal with. When you look at numbers, and numbers can be, I think, deceiving, but I think it's important in this context, is we do over 1,700 evaluations a year with our crisis response team.
Wow, 1,700.
1,700 evaluations, and we're going to surpass
that
that.
means there's 1,700 people having mental health crises,
Well,
right?
there's some people that get multiple evaluations.
Oh, okay. Oh, okay. So, okay.
But it's
how many uniques?
I don't know.
Okay.
But
okay.
most of the people that we see are new to us, which I think is alarming to some people. So, that is not alarming when you think about some of the geography that we deal with in Gallatin in particular, is where most of the evaluations occur. Most people, might be coming here for college, or they're just coming here new to move here, and Gallatin has the highest population growth rate in the state, so there's a lot of factors that contribute to kind of increase mental health services here and increase crisis services here. Mm-hmm. So that's on the rise, and I don't see that changing. Some of that is good in the sense that people are accessing help before it gets really bad. We'd really like people to access help further down the continuum before it becomes a crisis, but again, that's a whole different discussion on how we kind of continue to impact that. Mm-hmm. But 1,700 evaluations, 8 beds, we average right around 6+ people a day on the voluntary side. So that's how many people are generally there. And then there are plenty of days that were full, and some days were lower than 6. Mm-hmm. On the emergency detention or the involuntary side, Park County averages at right around 12 to 15 emergency detentions for the whole year. Okay. And Gallatin's right around 60 to 65 emergency detentions for the whole year. That gives you a sense of, again, small number. Most people that are in a crisis want help, and they really want things to change or improve. Yeah. Very small percentage end up being people that, because of their mental illness, they really can't or are unable to kind of get help, and that's when the court has to step in. People that have mental illness, there needs to be some accountability from them to have a plan for themselves when they're in crisis. And so I think there is this reality that there has been bad outcomes and bad experiences with the mental health system, and even if that is the case, which is unfortunate, there's still got to be a plan of what is going to happen with you so that the loved ones and the people around you kind of know how to kind of come in and wrap your arms around you. And there's some advanced directives and some wrap plans and stuff that kind of deal with that. But we hope that the Hope House is a place for people that are in our catchment area, that is a place that they can come and get treatment and healing. And the physical atmosphere and environment is very conducive to that. It's anybody who's had an experience in an inpatient psychiatric hospital, it's not going to feel or look like that at the Hope House. So there's very much a warm house environment, and we try to construct the facility to not feel like an institution, but we have a lot of the same services that are there. We have therapists that are there each day, so people go there and they get group therapy, they get individual therapy, family therapy. We have providers around, we have nurses that are available. We keep people pretty busy and are very kind of clear that when you come here, this is going to be a place of healing and rest, but it's going to be a place of, we got to get some stuff done too.
Yeah, absolutely. And in fact, as you were speaking, it just made me realize how progressive this is. That this is to create a warm, nurturing environment and not to have it feel like an institution. What a step in the right direction for mental health. I really...
It is, and you got to give the state, and I say the state in a loose term, but you got to give credit for having these sort of models in Montana. And so this model isn't unique to Bozeman. We have similar models in Butte, Hamilton, and there's one coming online in Helena, and then one in Ronan Polson. And so it's a needed level of care, if you will, or kind of intervention model for Montana, because we have geography, and the ruralness of what we have is unique to Montana and a few other states. But it's really cool because it allows resources to be used to their fullest, mm-hmm. and it allows it to be used kind of really on a true community level. And I think that's the cool thing, is each community with these crisis houses have been able to adapt to what their specific community needs are and have those met, and that's pretty cool.
That's very cool. That is so heartening and so hopeful. I love that. So now I think we've pretty well covered crisis intervention, except for that you put out some terms of wraparound services, and maybe you could just spend a minute talking, what are wraparound services?
Well, what I meant was the WRAP plans.
Oh.
So, Wellness Recovery Action Plans.
Oh, yeah, which is wonderful.
Yeah.
I'm going to put a whole thing
Yeah,
about
so you'll
wrap
do
in
that,
there.
but
I'll do that,
I
so we
think,
don't need to worry about that.
You know, again, the key elements, you know, as we wrap up is the crisis intervention training for law enforcement is key. And again, I have to point out that law enforcement is a critical factor, but the majority of people that access help, even in crisis, do not involve law enforcement, and they come voluntarily and willingly.
Mm-hmm.
But the times that law enforcement is involved, it's a very high-end, critical kind of encounter, and that is so much improved in the last 5 to 6 years because those encounters are going a much different direction than they did 5 years
More
ago.
loving?
Absolutely, and it wasn't that law enforcement were unloving.
Right.
It's that there's more partnerships and trust and relationships about what's going on.
Mm-hmm.
And law enforcement, again, has led the way here in this region. It's been very cool. So there's that CIT, and you hate to use a lot of acronyms, but there's a crisis intervention training for law enforcement. We have the crisis team that is available 24/7, and they go out and do the evaluations for people. So that crisis response team, the crisis line that I mentioned is critical because if, you know, as we talk here, you start to go, oh, there's all this info. Just remember to call the crisis line because they are available to talk to somebody 24/7.
And is that the 211?
That's 211. That's ran by the Help Center. They're a great organization.
Mm-hmm.
And so they can talk somebody through if there's concern. Well, what I should do, should I go here or there? What's going on? They can kind of be that first level of kind of like, let's talk about what's happening and I can help guide you through this crisis.
Mm-hmm.
So the crisis line, crisis intervention team, the law enforcement and our crisis team, and then the Hope House, which is that kind of in placement or kind of evaluation piece. That's really kind of what makes up the core crisis system. And then around all of that, you get all of the outpatient services,